Did you know that 1 in 8 men in the United States will be diagnosed with prostate cancer in their lifetime? And what's most concerning is that this disease progresses silently, without giving many signs in its early stages. This means you could be sick without even realizing it. But here's the good news. If you recognize the early signs, your chances of being cured are over 90%. If you are over 40 years old or know someone who fits this profile, father, brother, husband, or friend, this video might be the most important one you'll watch today. We will discuss 5 signs of prostate cancer that you cannot ignore. Paying attention to these changes in your body might be what saves your life or the life of someone you love. So, stay with me until the end, because I'll also share practical tips on how you can protect yourself from this disease. And before we begin, leave a like, subscribe to the channel, and share this video. This simple action can help save other lives. Let's get started. The importance of early diagnosis. Prostate cancer is the second most common type of cancer among American men, second only to skin cancer. According to the American Cancer Society, more than 288,000 new cases will be diagnosed this year. The most shocking statistic? Approximately 34,000 men will die from this disease. And many of these cases could have been prevented with early diagnosis. Here's the problem. Men in general are reluctant to seek medical help. Maybe you think it's nothing serious, or that going to the doctor might be uncomfortable. But the truth is that preventive exams, such as the PSA test, which is a simple blood test, and the digital rectal exam, are essential to identifying prostate cancer before it progresses. Starting at age 40 or 50, depending on your family history, these exams should become part of your routine. If you think everything is fine because you don't have any symptoms, be careful. Prostate cancer doesn't usually show clear signs in its early stages. That's precisely why prevention is so important. If you notice any of the changes we are about to list here, don't wait. See a doctor immediately. Sign 1. Difficulty urinating. Have you noticed that it's becoming harder to urinate? Is the flow weaker or interrupted? Sometimes, you feel like your bladder isn't fully empty, and you need to go to the bathroom multiple times, especially at night. It might seem like a simple issue, but this is an important change that deserves your attention. The prostate is located just below the bladder and surrounds the urethra, the canal that carries urine out of your body. If the prostate grows abnormally, as in the case of cancer, it presses on the urethra, causing these difficulties. These problems can be caused by benign conditions, such as benign prostatic hyperplasia, BPH, but they can also be one of the first signs of prostate cancer. So if you're noticing these changes in your daily life, don't ignore them. Your body is trying to tell you that something isn't right. Sign 2. Blood in urine or semen. Imagine going to the bathroom and noticing blood in your urine or semen. It's frightening, isn't it? While you might think this is just an infection or a temporary issue, the truth is that this can be an important sign of prostate cancer. Blood appears because the prostate becomes inflamed or because the disease affects small blood vessels in the region. Sometimes you might only notice small spots or a slight reddish tint, but that is already enough to seek medical help immediately. If you notice blood, don't wait to see if it goes away on its own. Prostate cancer in its early stages can be treated much more easily, so acting quickly makes all the difference. Sign 3. Constant pelvic pain or discomfort. Do you feel persistent pain in your lower abdomen, pelvic region, or even the perineum, the area between the anus and the genitals? Maybe this pain radiates to your back or hips and doesn't seem to improve with rest. If this is happening to you, it's important to pay attention. As the prostate grows, it can press on nearby nerves and tissues, causing discomfort and chronic pain. Often, men assume that this pain is just a muscle strain or something unimportant, but if it doesn't go away and persists for weeks, it's time to see a doctor. If the pain is accompanied by other symptoms, such as difficulty urinating or the presence of blood, this can be an even clearer sign that something serious is happening. Listen to your body. Sign 4. Unexplained weight loss. If you're losing weight without having changed your diet or exercise routine, this deserves attention. Unexplained weight loss is one of the most common signs of cancer in general, and prostate cancer is no exception. When cancer develops, it consumes a lot of energy from your body, causing you to lose weight quickly. Additionally, the disease can interfere with nutrient absorption, leaving you feeling weaker and more tired. If you've noticed that you're losing weight for no reason, and this is accompanied by other symptoms, such as pain or difficulty urinating, seek medical attention as soon as possible. Sign 5. Bone or back pain. This is a sign that may indicate the prostate cancer has already spread to the bones, something doctors call bone metastasis. If you're experiencing persistent pain in your bones, especially in the spine, hips, or ribs, and this pain seems to worsen at night or with movement, do not ignore it. Bone metastasis is a sign that the disease is in a more advanced stage, but even then, seeking medical help can ensure treatment that prolongs your quality of life. Therefore, if you're facing this kind of pain, even if it seems like something common, such as back pain, see a doctor and get the necessary tests done. Take action, don't wait. If you've identified any of these symptoms, don't put it off. Seek medical help and undergo your preventive tests. Remember, the PSA test is just a simple blood test, and the digital rectal exam only takes a few seconds. It might seem uncomfortable, but it's something that can save your life. If you're over 40 years old or have a family history, get your tests done annually. Take care of yourself and encourage the men in your life to do the same.